Cancer screening. Cancer screening is a crucial aspect of healthcare aimed at detecting cancer in its early stages or even before it causes noticeable symptoms. Early detection can significantly improve the chances of successful treatment and better outcomes for patients. The specific screening methods and guidelines vary depending on the type of cancer, individual risk factors, and medical advancements. Here's an overview of the general principles and some common cancer screening methods. Principles of cancer screening. Early detection. Screening aims to identify cancer at an early stage, often before symptoms develop, when treatment is more effective. Asymptomatic stage. Screening targets individuals who show no symptoms of cancer but have risk factors that make them more likely to develop the disease. Cost-effectiveness. Screening methods need to strike a balance between costs, potential benefits, and potential harms. Accuracy. Effective screening tests should have a high sensitivity, correctly identifying people with cancer, and specificity, correctly identifying people without cancer. Risk-benefit balance. The benefits of early detection and treatment should outweigh the potential harms, including false positives, false negatives, anxiety, and overdiagnosis. Common cancer screening methods. Breast cancer. Mammography. X-ray imaging of the breast tissue used to detect abnormalities that could indicate breast cancer. Regular mammograms are recommended for women of a certain age, usually starting at around 40–50 years. Cervical cancer. Pap smear. A test that involves collecting cells from the cervix to detect any precancerous or cancerous changes. Pap smears are usually recommended for women starting in their early 20s. Colorectal cancer. Colonoscopy. A procedure that allows a doctor to examine the entire colon and rectum for polyps or other abnormalities. Colonoscopy is recommended starting at around age 50 for individuals at average risk. Prostate cancer. Prostate-specific antigen (PSA) test, a blood test that measures the level of PSA, a protein produced by the prostate gland. Elevated PSA levels could indicate prostate cancer. Recommendations for PSA testing vary and depend on individual risk factors. Lung cancer. Low-dose computed tomography, LDCT, a type of CT scan that uses a low dose of radiation to create detailed images of the lungs. LDCT is recommended for individuals at high risk of lung cancer, such as heavy smokers. Individualized risk assessment. Individual risk factors, such as age, family history, genetic predisposition, lifestyle, and exposure to certain carcinogens, play a significant role in determining the appropriate cancer screening approach. Healthcare providers consider these factors when recommending screening tests and schedules. Limitations and considerations. False positives and false negatives. Screening tests can yield inaccurate results, leading to unnecessary follow-up procedures or missed diagnoses. Overdiagnosis. Some cancers detected through screening might never progress to a clinically significant stage, leading to unnecessary treatments. Anxiety and psychological impact. False positives and waiting for results can cause anxiety and stress. Costs. Some screening methods can be expensive, and access might be limited for some individuals. It's important to note that screening guidelines evolve over time as new research and technologies emerge. Therefore, individuals should consult with their healthcare providers to determine the most appropriate cancer screening plan based on their personal risk factors and the latest medical recommendations.